Hi, I'm Dr. Warren Kalkstein, and I wanted to take a few minutes to speak about Dr. Ferguson and the grip approach that he's brought to our office here in Towson, Maryland. So I've gotten to know Dr. Ferguson over the last couple of years, more so in a professional capacity around business development, personal growth, and just listening to him speak, my curiosity was kind of piqued with how well he articulated himself around clinical subjects. And when he talked a little bit more about grip and bringing it to our office, I told him that, I loved his concepts of neurodynamics, I loved his rehabilitation protocols, but the idea and the concept of bringing a whole new system to our office was very daunting. We're a busy practice, there's 6 providers, and we already kind of have our system set up, if you will. And so I was a little unsure about how that was going to change things relative to our diagnosis and relative to our treatment patterns. And I've been really surprised this weekend on how well he's created a system that creates a really nice flow between different providers within the office. We have 2 LMTs, we've got 4 support staff, extenders, if you will, that provide rehabilitation and fitness programs. So having something that ties the clinical team together is something I've always wanted, and Ben's really created a great program, and I'm excited to see how we implement this over the next couple weeks, how we collaborate as a group, how we take the different providers' inputs from a soft tissue standpoint, from a rehab standpoint, as well as from our diagnosis, and how we start to change our clinical experience for our patients. My hunch was true, if you will, about his clinical expertise. He knows a lot about a lot of things. And then I have been surprised by his ability to implement a program that I can see us using going forward to help streamline patient care and give patients a better experience. So I highly recommend his course for a few reasons. One, we've touched on a lot of different clinical topics. It's just nice to go back and touch base on neurodynamics and developmental kinesiology and soft tissue trigger point therapy, as well as using the radial pulse wave machine, opening up a new modality in the office. That alone has been great. He's brought multiple different providers from different backgrounds that each have their own expertise that have allowed us to kind of divide and conquer amongst the group. So if you got a big team and you're looking for not just one person to speak the whole weekend, this is a great way for hands-on practice and for a lot of people to get some reps, if you will. So I'm grateful for that component of it as well. He's got an awesome group of instructors that come in and really put on a great weekend. So it's been a long weekend. It's a lot of learning, but at the same token, I'm really glad that we stepped into the ring with them because it's challenging the way that we do things, and we needed that challenge. Dr. Ben and his awesome team, thank you so much, and I highly recommend it. If you've got a group of providers and you've got multiple touch points for your patients and you're looking for more collaboration, and if you're just looking to sharpen your clinical skills around neurodynamics, developmental kinesiology, soft tissue therapies, as well as diagnosis in general, he's awesome. So thank you again.